focus on.
Ladies and gentlemen, good afternoon, and good of you to join us for another Emergency Operations Center, NEOC, COVID-19 briefing for today, Wednesday, the 2nd of March, 2022. These weekly briefings, of course, afford us the opportunity to stay informed about our local status on the COVID-19 pandemic, as well as it affords you, our listeners, an opportunity to seek further clarifications on any concerns or queries you may have on any of the presentations made here today. My name is Michelle Rodriguez, NEMA's Public Relations Officer, and I will be hosting in the absence of our regular host, Mr. Lesroy William, the Director of SKNIS. Ladies and gentlemen, please send your questions early to the number that is displayed across your screens so they can be put to the presenters before we conclude today's briefing. I will now like to invite our first presenter for today, Dr. Cameron Wilkinson, Medical Chief of Staff at the JNF Hospital, to give us his presentation.
Thank you very much. We have passed the surge in COVID-19 cases we experienced in the fourth wave that started on December 24th last year. We don't need to be operating in emergency mode anymore now, and we will begin to see a significant relaxation of control measures internally as we attempt to get back to some sense of normalcy. Serious cases and deaths remain at an all-time low, despite the fact that the virus is still circulating in our community. We now have 4 confirmed cases in St. Kitts and 0 in Nevis, and this is great news. Remember that the positive cases reported reflect the laboratory confirmed cases. A report of 0 laboratory confirmed cases in Nevis does not mean that the virus has suddenly disappeared from Nevis. There could still be persons who are infected but asymptomatic or with such mild symptoms that they have absolutely no reason to present to the health services for testing. They could therefore be unknowingly moving about normally but infectious and present a serious threat to the clinically vulnerable, including people living in nursing home and long-term care facilities, the elderly, and people of all ages with underlying health conditions such as diabetes, heart disease, lung disease, and obesity. We therefore need to maintain our vigilance and not throw caution to the wind as we move forward. Our high threshold of population immunity is what gave us the buffer against the highly contagious Omicron variant and has allowed us to continue with the progressive reopening of all sectors of society. We started our vaccination program just over a year ago on February 22nd, 2021, and it has been a great success. We now have 82.6% of adults in the Federation with at least 1 shot and 77.4% fully vaccinated. On the island of St. Kitts, the coverage is even higher, with 87.3% of adults with 1 shot and 81% fully vaccinated. I want to take this opportunity to say a big thanks to the people of our beloved Federation for heeding the call and going out in great numbers to protect themselves and their loved ones by getting vaccinated. At a time when we face the greatest crisis of our lifetime and in our nation's history, you rose to the occasion and did what was best for your country and in turn yourself. It could not have been an easy decision with the loud noise and distraction coming from naysayers, but you stayed focused and listened to facts and science and did the right thing and got vaccinated. This was a new virus and our first pandemic, and we did not have all the answers, but we kept you updated over the last 2 years with information as it unfolded. We followed the best scientific evidence available and have had a relatively successful fight against this highly infectious and deadly virus. We were able to prevent the overwhelming of our healthcare system, as we saw happen in nations with greater resources than ours across the globe. We now have 0 persons hospitalized in St. Kitts and 0 in Nevis from COVID-19. We are now at a point where we can relieve ourselves of the stranglehold that COVID-19 has had on every aspect of our lives. Scientists and public health officials continue to work to find more answers to key questions as to how the disease affects the body and why some cases are more serious than others, and to identify the best treatments going forward. Because knowledge about the new virus is evolving rapidly, you can expect information and recommendations to continue to change. When we provide you with new and updated information, we are not lying to you. We are simply keeping you updated and informed. That is the nature of science and discovery. We will soon be ending these regular briefings, but the circulation of misinformation by some will continue. I urge you to trust information only from reputable health organizations and sources such as the CDC and the World Health Organization as you attempt to navigate the new norms. Vaccination still remains the key strategy for fighting COVID-19 as we peel back restrictions imposed by governments. Personal responsibility is now at the core of this fight, and I urge you to make the right decision by getting vaccinated. The non-pharmaceuticals that we have preached, including frequent hand sanitizing, social distancing, and wearing a mask in public, still help with the reduction of viral transmission. I ask that you continue to adopt the COVID-19 appropriate behavior in your everyday life and go out and get vaccinated if you have not yet done so as yet, and get boosted if you are eligible. The pandemic has been very stressful for everyone, but I do believe that the emergence of the Omicron variant has been a game changer, and we will soon begin to function in near pre-pandemic manner. We still have a lot of work to do, and we'll continue to work behind the scenes, even if you do not see us here on a weekly basis going forward. I want you to stay safe, protect yourself, get vaccinated, get boosted. Thank you.
Thank you, Dr. Cameron. I will now invite Dr. Hazel Laws, Chief Medical Officer and Co-Chair of the National COVID-19 Task Force.
Thank you, Michelle, and a pleasant good afternoon to everyone. Despite the local situation, the COVID-19 virus continues to spread, and the COVID-19 pandemic continues. The World Health Organization is presently monitoring outbreaks in some 47 territories or countries globally. To date, 435.6 million cases of COVID-19 have been confirmed globally, with over 5.9 million deaths and over 10.6 billion COVID-19 vaccinations have been administered globally. And the Caribbean region is no different, with over 3.2 million cases reported in over 35 countries or territories within the Caribbean region, over 32,617 deaths, and in terms of COVID-19 vaccinations, over 24.8 million doses have been administered within the Caribbean region. When we look at data coming out of the Caribbean Public Health Agency, the Omicron variant of concern and the Delta variant of concern are in circulation in the Caribbean region. Now, the World Health Organization recently announced these 4 global targets. We became aware of these earlier this week. I think it was on February the 28th, as we attended the 9th ACTA Facilitation Council meeting. These global targets are as follows. The aim is to, 1, vaccinate 70% of persons in every country by mid-year 2022 or by June 2022. Secondly, the aim is to reach a minimum testing rate of 100 tests per 100,000 persons per day. And this is, all territories globally. Thirdly, the aim is to provide care for all COVID-19 diagnosed cases in all countries. And fourth, the aim is to protect all our essential healthcare workers in terms of PPE, and I'll add through vaccination also. So these are the WHO targets set for all countries globally, including St. Kitts and Nevis. Now, in terms of our COVID-19 vaccination program, it's been over a year, 1 year now, since we've rolled out this program, and we have done well. In terms of the adults in our population, 77.3% of the adults are fully vaccinated, and 82.6% have received their first dose. 9.2% of the adults have come forward and accepted their booster shot. In terms of our children, 12 to 17 years, 16.9% are fully vaccinated, and 18.5% have received their first dose. This slide shows the data disaggregated by island, and so you can see that in St. Kitts, 80.9% of the adults are fully vaccinated, and in Nevis, 67.8%. In terms of the children, 12 to 17, 17.6% of the children in this age group in St. Kitts fully vaccinated, and 14.9% in Nevis. Our aim in the Ministry of Health is to narrow this gap. Now, the last column is very interesting. In terms of the total population in the Federation, 55.8% of the total population fully vaccinated. But let's look at that data, that variable disaggregated by island. 57.3% of the population in St. Kitts fully vaccinated, 51.7% of the population in Nevis fully vaccinated. And at the bottom, you can see the global target that we are chasing. So by June, we want to aim to achieve a 70% coverage rate in terms of of our population being fully vaccinated. It's not unattainable, but we can work together, all of society, in terms of making this happen. Because the vaccine is still the best means of protection as we try to chart our way out of this pandemic. We recently received some 24,300 doses of the Pfizer-BioNTech vaccine, and we have received 3,000 doses of the AstraZeneca Oxford vaccine. Let me repeat, the Ministry of Health, the Federation, we just received 3,000 doses of the AstraZeneca Oxford vaccine. I've repeated this because there are a number of individuals who have in 2021 come forward and started their vaccine, their primary series. So in other words, they have 1 dose of the AstraZeneca Oxford vaccine in hand, and so they were awaiting the arrival of this batch of AstraZeneca vaccine. So feel free to come out to any of our health centers to receive the second dose of your AstraZeneca Oxford vaccine. This captures or summarizes the current COVID-19 situation in the Federation. So to date, the Federation has reported a total of 5,530 laboratory-confirmed cases of COVID-19. In terms of active cases, we have 4 active cases as at this afternoon, Wednesday, as of this afternoon, Wednesday, March the 2nd. In terms of recoveries, we've had 5,483 cases recovered, and to date we've only reported 42 COVID-19 related deaths, 7 for Nevis and 35 for St. Kitts. Now, in terms of the COVID-19 related deaths, in terms of gender, about 62% of these individuals were male. This trend is not just unique to St. Kitts, it's the global trend where the deaths, males are seem to be predisposed to death from COVID-19. And the unvaccinated also at risk of death, whereby 86% of the 42 cases were unvaccinated, and then the majority, or 79%, were over 60 years, and I dare say they also had chronic non-communicable diseases. Now, in terms of this current fourth wave, we are seeing a decrease in the number of cases daily. And so this past week, we've only registered 7 laboratory confirmed COVID-19 cases, and we've had 22 cases recovered in this same period. And you can compare the data for the previous week, and you realize that we are approaching the end of this fourth wave. We are not yet totally out of this fourth wave, but we seem to be approaching the end thereof. In terms of COVID-19 testing, we continue, and please note that all persons in the Federation who have come forward to access testing, they have been tested. So persons with or without symptoms, persons who are about to travel, outbound passengers who are in need of testing, they have been able to access COVID-19 testing. And so that's one of the successes that we enjoy here in the Federation. COVID-19 testing is readily and continue to be readily available. Now, in the Federation, all persons who are diagnosed with COVID-19, they are also able to access care, medical care. So majority, they are only mildly ill, and so they are followed up by our case managers. There are a small percentage who would go to the emergency room for care, and some have been admitted to the COVID ward or the ward at the Alexandra Hospital. And so all persons diagnosed with COVID, they have received adequate care. We have the country as a whole, we were able to procure adequate supply of PPE for our healthcare workers, for our frontline workers. And our healthcare workers are also able, or they have access to adequate supply of COVID-19 vaccines. Now, in terms of the health and travel protocols, I want us to pause and focus a bit. Just this week, Cabinet has granted approval for 3 changes to our health and travel protocols. Please note that these 3 changes became effective March the 1st, 2022. So number 1, the first change, so there will be no quarantine for persons coming in with any of these 5 vaccines. So individuals who are coming from Cuba or Taiwan are coming in with any of the 3 vaccines available in Cuba, that vaccine, the Medigen vaccine available in Taiwan, or the Sputnik 5 vaccine, they will be allowed to come in, and they will not have to serve a quarantine period. So no quarantine for persons coming in with any of the 5 following vaccines. These vaccines have not yet achieved WHO emergency use listing. And these vaccines are 1, Abdala vaccine, 2, Sabarana 2 vaccine, 3, the Sabarana Plus vaccine, 4, the Medigen vaccine, and 5, the Sputnik vaccine. So individuals who are fully vaccinated with these 5 vaccines, they can be allowed in and they would not be required to go into quarantine. The second change, unvaccinated nationals who are coming home, prior to this, they were asked to complete a period of 9 days quarantine. So this quarantine period has been reduced to 7 days. So there's a reduction in the quarantine period for unvaccinated returning nationals. And please note that this reduced quarantine period can be completed at home without the paid security facility. Let me repeat, this reduced quarantine period can be completed at home without the paid security facility. The third change refers to persons in the Federation who are planning short trips to neighboring islands. When I say short trips, I mean trips within that, in terms they would leave St. Kitts and return to St. Kitts or Nevis within a 24-hour period. So in other words, they are not overnighting. So such individuals who leave the Federation and travel to a neighboring island for less than 24 hours can return by completing the entry form on the URL as noted on the slide. They are also required to submit a negative COVID-19 test done prior to departure. So for example, if you're going to St. Martin and an antigen test is required to go to St. Martin, you can upload that negative test onto the platform and you can get approval to return on that test. However, travelers will be tested for COVID-19 upon arrival back into St. Kitts at RLB or Vance Amory airports. Or if you're coming in by sea, you can access testing through any of the laboratories on island. These travelers will be flagged for 24-hour quarantine period until their negative test result is returned. The rest of the health and travel protocols remain the same. Let me repeat, the other health and travel protocols remain the same. I want to underscore that all visitors coming into the Federation, they must be vaccinated, and all inbound air travelers must still submit a negative RT-PCR test done within 72 hours of arrival. Ladies and gentlemen, even though we are approaching the end of this 4th wave, we still have to adhere to the COVID-19 prevention and protective measures. In terms of vaccination, we still continue to encourage those who are not yet vaccinated to come on board, and we are still advocating the wearing of the face mask at all times when in public places, and we are still advocating the maintenance of adequate hand hygiene. We are still adhering to ensuring or recommending that you maintain adequate distance between yourself and others. Now, let us just pause there a minute. Now, in terms of where we are at the end of this 4th wave, and given the level of immunity, vaccine-acquired immunity and immunity through infection, and given the fact that we are still wearing our face mask, we can adjust that space or distance between ourselves and others. And so those, business entities like the banks. Yesterday I went to the bank and I had to stand outside in the sun for quite a while as I advanced in the line. And so we can, we are recommending that these business entities, you can relook the capacity or the number of persons you allow on the inside at any one point in time. You can allow more individuals in, given where we are at in terms of our outbreak. But we still have to monitor that distance between ourselves and others. It may not have to be 6 feet, but we still need to maintain some distance. And last but not least, if you are experiencing respiratory tract symptoms, we are asking you to stay at home. So anecdotally, we are receiving complaints from parents with children in the early childhood sector, whereby parents that are still taking ill children to school. So parents with children who are coughing, sneezing, having or experiencing runny nose, and even having a fever, please keep that child at home and access care. Do not send or take that child to school. So if a child is experiencing respiratory tract symptoms, coughing, sneezing, runny nose, having a fever, that child should really remain at home, and as the parent or guardian, you should access care for that child. Thank you.
Thank you. Thank you, Dr. Laws. I would like to recognize the Honorable Wendy Phipps, Minister of International Trade, Industry and Commerce, Consumer Affairs and Labor, in our presence this afternoon. I will now invite Superintendent of Police, Mr. Cromwell Henry, to give us his presentation.
Thank you, and a pleasant good afternoon to all listening to this broadcast via whatever means. One thing that bonds people on the weekend is a nightclub or bar. The lights, music, and meeting with friends is an ideal way to unwind after a long week. The nightclubs and bar owners are thrilled by this activity because it means they will be able to pay the bills from the cover charge and drink sales. Having people in your establishment is a good thing. However, things can quickly change and get out of hand. An overcrowded building can lead to civil or criminal liability. Some of the basic risks that become more of a threat as the attendance increases are injury risks from not enough space, inability to control the crowd, fire hazards, property damage, maintaining hygiene and health protocols, and security risks. While businesses can have insurance to mitigate some of these risks, there are also costs that business owners are personally liable for because of their responsibilities. When situations can be avoided, claims can be denied or accepted with reduced payout. Another point to consider is that patrons and performers need to feel safe in their environment. Keeping a good reputation is imperative to running a successful business. The police at this stage are concerned about these safety issues, particularly at small indoor venues with one entry and exit point. Therefore, our approval processes and enforcement efforts are intent on mitigating these risks in the interest of public safety. The chairman announced on a previous occasion that the logging of names for contact tracing at businesses is no longer required. This continued to be so. You will note, however, that when permission is given to certain type of events in certain venues, that requirement to log names is imposed. However, it is not for contact tracing, but rather a safety measure to ensure the venue-approved capacity is not exceeded. We continue to appeal to our people's good judgment and sense of personal responsibility in avoiding unsafe situations and your cooperation with law enforcement as we strive to ensure your safety. Remember, COVID-19 is still a reality, so we admonish you to still take all the necessary precautions. Avoid crowds and crowded places, practice good hand hygiene and sanitization behavior, wear a face mask when in public, maintain a safe distance from others when in public, and where possible, get vaccinated. Thank you.
Thank you, Superintendent Henry. I will now like to invite Mr. Abdias Samuel, the National Disaster Coordinator of NEMO and Chair of the National COVID-19 Task Force, to give us his presentation.
Pleasant good evening or good afternoon to all. Thank you, Michelle. To all of those watching via the various means, again, thank you for being here with us. I also will continue in the same vein like all my colleagues bringing good news. Dr. Wilkinson did it. CMO gave good news on the easing of restriction. Superintendent Henry gave some sound and wise words. Let's see what I will bring to the table. All right, so we have been discussing with you about the St. Kitts Nevis Football Association. And just to share some statistics with you, the SKNFA president, Mr. Tiba Harris, provided the National COVID-19 Task Force with some statistics for the Senior Men's League. And they are as follows. 40 to 50% of the active football players are fully vaccinated. Over 60% of the coaches and support staff are fully vaccinated, and over 80% of other associated staff are fully vaccinated. Based on our current situation here in St. Kitts and Nevis, which we all must be proud of and happy about, the Cabinet has granted the approval for the resumption of the St. Kitts Nevis Football Senior Men's St. Kitts Association Senior Men's Football League effective 1st March 2022. Let me repeat. The Cabinet has approved the resumption of the SKNFA Men's Senior League Football effective 1st March 2022. And that same vein, I will continue within the sporting sector. The Cabinet as well has agreed and approved the resumption of cricket effective the 1st March 2022. This was based on a presentation made by Mr. Dennis Phillip on behalf of the Cricket Association. And based on all the statistics presented, we agreed that they can resume their league. I also would have stated to you previously, that the St. Kitts Music Festival would have made a presentation to the National COVID-19 Task Force. The chairman, you call it, our president of the St. Kitts Music Festival, Mr. Damian Hobson, would have presented some statistics and proposal, and I will wish to share some with you. They are proposing that the 23rd to the 25th of June 2022, from the hours of 7 p.m. to 2 a.m., thereabout, that's the period in which they are proposing to have or host the St. Kitts Music Festival. They have requested approximately 4,000 to 6,000 patrons for each night. That's the Thursday night, Friday night, and Saturday night. And the venue for this year's potential hosting of the St. Kitts Music Festival will be at the Kim Collins Stadium. I am pleased to announce to you that the Cabinet has approved the hosting of St. Kitts Music Festival in June of 2022. And you would have heard my colleagues speak about the restrictions, the easing of COVID-19 restrictions, the recording of names, the temperature checks, etc. Again, we are appealing to businesses that you can discontinue some of these practices. But again, as Superintendent Henry said, part of the criteria in the interest of public safety for some of the events in enclosed areas that poses a significant risk or threat to the patrons and everyone else, and even the first responders, you will be required to carry out the name-taking exercise. And the CMO, I just want to also highlight, as we speak about further easing of restrictions, the CMO would have indicated that we would have made some recommendation as we continue to ease. So a lot of persons were calling about having to pay for security while they're at home. That's inbound travelers into St. Kitts and Nevis. So again, and the recommendation and the consideration and approval of Cabinet, so this has been removed. So therefore, what does this mean? Let me explain. Abdia Samuel, passenger A, traveling from Miami and wants to return home to St. Kitts, unvaccinated. So therefore, passenger A, Abdia Samuel, arrives after completing and getting the approval on the KNA travel platform, arrives in the Federation of St. Kitts and Nevis. He is flagged and processed. However, he's flagged and processed. He will be sent to do his 7-day quarantine, and he will have to utilize a COVID-19 certified taxi for now. He goes home, spends his 7 days quarantine as a new reduced period for unvaccinated, and day 7, the Ministry of Health, they would contact you and let you know when you need, they will contact you and let you know when your day 7 test will be. Once you receive your negative results on the 7th day and you are negative, then you will be released from quarantine. Yes, there will not be any monitoring system, so we're not going to put a bracelet on you. We're not going to put nobody to hunt you down. However, here's the reality. The penalties are still in existence if you break quarantine. Again, let me repeat, the penalty still remains if you break the quarantine. So therefore, I'm appealing to all individuals not to abuse this easing of this particular restrictions. We cite as a particular burden on you, the unvaccinated inbound traveler, and we thought it best to give it consideration and have the Cabinet agree to the removal of this protocol. So again, you need to exercise that personal responsibility, because if you are seen and you break the quarantine, then you will be taken before the court to face your penalty or your crime. Ladies and gentlemen, AJ, again, I want to invite all the stakeholders within the Federation of St. Kitts and Nevis who have been invited by NEMO to attend our National Stakeholders Orientation. Please do your best to be there on Friday, 4th March at the Marriott Ballroom. So the poster says it all. It says the Federation of St. Kitts and Nevis, we are in it together, strengthening NEMO NDMD, the CDM audit tool. This implementation and capacity building exercise. So again, the stakeholders and St. Kitts who have received their invitation, please make a special effort to attend as we seek to enhance and strengthen our preparedness, response, mitigation, and recovery capabilities. Ladies and gentlemen, we have been going for a long time. I would have announced previously that our last briefing would be in April. However, as we see the situation getting much, much better, we have agreed and Cabinet has supported that we will have our last NEOC briefing on the 30th of March 2022 at 5 p.m. as per the usual. So thereafter, NEOC briefings will be held on a situational demand. So if a situation requires and demands that we have a briefing, then we will come before you and provide information. With that said, I want to thank you for being with us all these times, and we are hopeful that by the next time we get to you, we can actually bring some much better news in terms of easing of restrictions. Thank you again, and take care.
Thank you, Mr. Samuel. Ladies and gentlemen, we have now come to our question and answer segment. And our first question is from Von Radio, and I'll read the question. The question says, will the government still make public the COVID-19 numbers during the endemic stage, or will they transition to internal figures?
The Ministry of Health will continue to provide the COVID-19 situation tile on a daily basis. If there is going to be a change with respect to the frequency of disseminating this information, we will announce it. But for now, yes, we will continue to disseminate the data on a daily basis.
Thank you, Dr. Laws. The second question reads, I am immunocompromised and took my third vaccine. Am I to go for a booster shot after 5 months?
For most of the two-dose vaccines, most healthy adults need 2 shots to get the required coverage. Persons who are immunocompromised, they need an additional shot to bring them to where the regular person is with 2 shots. And so the immunocompromised person at the end of completing their vaccination would have had 3 shots. The person with a normal immune system would have had 2 shots. They both would need to go forward 5 months later to get their booster shots. And so at the end of the vaccination process, the person with the normal immune system would have received 3 shots, and the immunocompromised person would have received 4 shots. I just want to add something to the question that was asked before also about whether or not the tile is going to be presented. Just because we are not going to be here on a weekly basis, it does not mean that we are not going to be working behind the scenes. The virus is still here. We'll continue to be providing, we'll continue providing the updated information on a daily basis. We'll be continuing to fight this virus until it eventually disappears from us. If it does, or if it becomes endemic, then we'll have to learn to live with it.
The next question reads, persons have complained that the nurses are no longer answering your question when you ask the expiry date of the vaccine being administered to you. Is it because the vaccines are expired?
We have said before, number 1, we have more than a sufficient supply of vaccines, and 2, we will not be administering any expired vaccines. We note your concern, and the CMO, we can speak to the nurses to make sure that if this information is asked, it can be given. They could even ask us to see the vial if they want it for proof. But the Ministry of Health is not in any way going to be administering vaccines that are expired, and we have more than a sufficient supply such that we don't need to resort to that. Okay, so any vaccine that you get into your hand, it is not expired.
I will read this. This will be the last question for today. There seems to be a gastro problem in the Federation. Could the health officials comment?
The Ministry of Health is closely monitoring what is happening. Yes, there have been one or two kids presenting with gastrointestinal-like symptoms. I will not say at this point in time that we have an outbreak, but we are closely monitoring it and we will keep you informed.
Every week, the Ministry of Health collects data from the hospitals. We call it syndromic surveillance, whereby we monitor the number of children that present with gastrointestinal symptoms. And it's usual to have a peak at this time of the year. And so at this time of the year, we are seeing a few cases, but it's not an outbreak. It's within the normal accepted level. And we are monitoring it closely. We always do. Thank you.
Thank you very much. Ladies and gentlemen, we have now come to the end of our NEOC briefing for today, Wednesday, the 2nd of March, 2022. I wish to thank all our presenters for today, Dr. Cameron Wilkinson, Medical Chief of Staff at the JNF Hospital, Dr. Hazel Laws, Chief Medical Officer and Co-Chair of the National COVID-19 Task Force, Superintendent of Police, Mr. Cromwell Henry, Mr. Abdiaz Samuel, National Disaster Coordinator of NEMA and Chair of the National COVID-19 Task Force, Dr. Marissa Carty, Dr. Marissa Carty, and the Honorable Wendy Phipps, Minister of International Trade, Industry and Commerce, Consumer Affairs and Labor, for their usual support. I also wish to thank the entire team who works ardently at making these weekly briefings possible. Mrs. Michelle Christmas Jacobs for signing during the briefing, the Open Interactive team for their continued services, the ZIZ technical team, especially AJ Evans, also our technical team, LeJean James, Miss Ophelia Blanchard, and the entire NEMA staff who work behind the scenes to make these briefings possible. Ladies and gentlemen, I thank you also for listening and for joining us today. I am Michelle Rodriguez saying goodbye.
Our children deserve a chance to have a healthy and happy childhood. They should be able to enjoy their youth, have fun with their friends, learn in the comfort of a classroom, and interact with others in the community. That's why I chose vaccination. It has been over a year since the pandemic started, and our kids have been forced to adapt to new lifestyle changes. Therefore, it is my job to ensure that they enjoy a childhood free of isolation and restrictions without fear and worry. While we continue to wash our hands, wear our masks, and practice social distancing, let's take it one step further and do our part as parents to help our children stand a greater chance at fighting this virus. Visit the nearest health center or call the Ministry of Health for assistance. We all have a role to play, so let's roll up to roll out. The